Recognizing June 15th as Elder Abuse Awareness Day. Cami Bremer, Commissioner, Board of County Commissioners. Holly Williams, Commissioner, Board of County Commissioners.
Commissioner Bremer.
I would like to move the following proclamation recognizing June 15th as Elder Abuse Awareness Day. Whereas June 15th has been designated as World Elder Abuse Awareness Day to shine a light on the problems of physical, emotional, and financial abuse of elders. And whereas the El Paso County Board of County Commissioners, the Department of Human Services, and our community partners recognize that senior citizens are valued members of our society. And whereas abuse, neglect, and exploitation is a tragedy inflicted on vulnerable senior citizens and is an ever-increasing problem that crosses all socioeconomic boundaries. And whereas combating mistreatment of senior citizens will improve the quality of life for all senior citizens in El Paso County and will allow them to live as independently as possible and contribute to the life and vibrancy of our county. And whereas the El Paso County Pikes Peak Elder Abuse Coalition is a collaboration among agencies, nonprofits, and businesses, and members are taking a proactive role in finding ways to assist elders who may be abused, neglected, or exploited. And whereas it is with thanks to community partners for their contributions in preventing abuse, neglect, and exploitation before it happens by developing community-based prevention, awareness, education, and training programs. Now, therefore, the Board of County Commissioners of El Paso County, Colorado, hereby proclaims June 15th, 2019 as Elder Abuse Awareness Day in El Paso County and urges all El Paso County citizens to join in recognizing and celebrating the many and varied contributions and accomplishments of our senior citizens on this day and throughout the month of June. Done this 6th day of June, 2019 at Colorado Springs, Colorado. Signed, Mark Waller, Chair, Lojinos Gonzalez, Vice Chair, Stan Vanderwerf, Holly Williams, Cami Bremer, members, the Board of County Commissioners of El Paso County, Colorado.
Second.
All right, that's been moved and seconded. We'll open it up to the public for some discussion. Chris?
Good morning, Commissioners. Chris Garvin, Department of Human Services. Julie Crow is in Denver today, so you have me.
We're lucky.
Thank you. Thank you. I appreciate you bringing forth this proclamation, especially to Commissioner Bremer and Commissioner Williams for sponsoring it. Thank you very much. As you mentioned, Saturday, June 15th is World Elder Abuse Day, and on that day, communities around the world and the country will sponsor events to highlight solutions towards this systemic social challenge. Our department will participate in this national conversation through a number of events, including this one and a number of those scheduled throughout June. I find it very pertinent, as you all mentioned, the 75th anniversary of D-Day, and that we honor the sacrifices of our seniors who participated in the invasion of Normandy. As Americans, we believe in justice for all, yet we fail to live up to this promise when we allow our older members of our society to be abused and neglected. Older people are vital, contributing members to our American society, and their maltreatment diminishes all of us. Just as we've confronted and addressed the social issues of child abuse and domestic violence, so can we find solutions to address the issues like elder abuse, which also threatens our well-being in this community. Our policies and practice make it harder for older people to stay involved and connected to our communities as we all age. As a result, older people are more likely to experience social isolation, which increases the likelihood of them being abused and neglected. Research suggests that 1 in 14 abuse cases is never reported to the authorities. We can design stronger societal supports to keep our older citizens connected and protect them from abuse, whether it's financial, emotional, sexual, or physical abuse. When we address this root cause, like social isolation, we can also make it less likely that people neglect themselves, the self-neglect category. Older adults who are socially connected and protected from harm are less likely to be hospitalized, less likely to go into nursing homes, and less likely to die prematurely. We can and must create healthier and safer living environments for older adults, including their homes, nursing homes, and in their assisted living facilities. So there's many ways that we as citizens can strengthen our community and prevent elder abuse. Just as it's everybody's responsibility to stop child abuse, the same can happen with elder abuse. It's up to us to talk to our leaders and to our neighbors about it, advocate for elder abuse prevention and intervention programs, do intergenerational programming, raise public awareness by conducting presentations and distributing materials about elder abuse. Also educate yourself and enable others to better recognize the warning signs of elder abuse. Lend strength to social supports. Stop the isolation. Be a friendly visitor to your neighbor. When I leave work every morning, I look across the street and see if Maggie's picked up her paper. She's 90 years old. If she doesn't, I go check on her. Also, I have a 90-year-old mother, so this is very important to me. And also provide support to caregivers who are caring for an elder. Don't tolerate ageism. This begins with not making fun of being old. Sometimes we joke, gosh, I'm getting old. I need my glasses. Contribute to building new social support structures. You can also report concerns to Adult Protective Services at 444-5755 or to law enforcement. You can get involved with the long-term care ombudsman program, working to resolve problems related to health, safety, and welfare and the rights of persons living in nursing homes and assisted livings. Become a volunteer of Silver Key, of the Colorado Springs Senior Center, or the Fountain Valley Senior Center. Thank you, Commissioners, for your support. Really appreciate it. And I'd like to introduce Eric Bidwell, who's our Manager of Adult Services.
Good morning, Chairman Waller, Vice Chair Gonzalez, members of the board. I am here this morning to further kind of this cause, this information, and to help spread the knowledge and information about elder abuse awareness. In our department, I oversee the adult protection area as well as eligibility for older and disabled adults. And in that position, I have the privilege of serving with and assisting the individuals that are doing this on a daily basis. I know that there have been some facts and figures about the successes of the Adult Protective Service unit that have been presented to you recently. And I find it amazing that they are able year after year to perform at the level that they do. And I think the reason they're able to do that is because they're some of the most committed individuals that I've ever met. They're committed to ensuring that individuals are protected. They're committed to finding out what the reasoning is in any particular case that they're given, to resolve those reasons and do everything possible to ensure that when the case is closed and that situation is done, and we have to walk away because our timelines are over, that adult, that individual is in a better position and a safer situation than they were prior. Out of the 5 measures that the Adult Protective Service area is held to every year, each month, that accounts for a total of 60 measures throughout the year that they have to uphold. They do that with a near impossible level of accuracy and have missed just one of those 60 measures over the last 12 months, proving that they are, in fact, humans. But in all seriousness, I think that, as I said, their level of commitment has really allowed us as a department to be the best we possibly can in serving the adults that we are committed to helping. And I would also like to say that we would not be able to do that if it weren't for the community partners that we work with on a daily basis. We have community partners with the police department and the sheriff's department. We have community partners with the Pikes Peak Area Aging Consortium. We have the Area Agency on Aging that assists us as well. We work with UCCS, we work with Silver Key. We work with pro bono guardians and professional guardians and the conservators in the court systems. We work with care providers that are doing that day-to-day provision of care to these individuals. We work with medical providers, whether it be in-home or in a facility or in a hospital. We work with TRE, RMO, and PACE, as well as the eligibility department within DHS. And we have a strong connection with all of those organizations. Each of those organizations allow us as a community to tackle the problem of abuse and mistreatment of our elder adults. And I genuinely believe, I've worked in 3 different states and I've worked within Department of Human Services for over 15 years. And I have never worked in an area where there has been such a strong sense of community and a strong relationship amongst the community partners as there is here in El Paso County. And I think that is what allows us to serve our adults and these individuals with the excellence that we do on a regular basis. I will briefly introduce, I know we have representatives of the CSPD here. We have Chuck Chakowski and Steve Worley. We have Chrissy Swanson, who's representing the Pikes Peak area, the Pikes Peak Elder Abuse Consortium. We have Dayton Romero, who's here representing Silver Key. We have individuals representing the Saba facilities that we work with on a regular basis and that are our strong community partner. And all of these individuals, along with the agencies and organizations that they represent, is what allows us to do what we're able to do every day. Thank you.
Thank you. And please, when you come down, state your name and sign in, and then you may begin.
Hello, Chairman Waller, Commissioners. My name is Kim Gallegos. I am a caseworker for El Paso County. I have been with the department for 7 years. I started out in child protection and where I was there for 5 years, and about 1.5 years, I made the switch over to Adult Protective Services, and it has been a pleasure to work with the elder population and to try to maintain them comfortably in their homes by least restrictive measures. I would like to share a success story with you that was a little different than our normal, everyday, run-of-the-mill, we get a call, we respond. In this particular situation, I had a gentleman in his late 80s. He is hard of hearing, and English is his second language. He lived in an affluent neighborhood with country club membership, not your run-of-the-mill clientele that we usually hear from. In this particular situation, we had a professional guardianship call us and make a report about concerns for the future. And we do not get involved in future allegations. Something has to be going on at that moment. But there were concerns. There was 2 gentlemen in this home, both elderly, being cared for by a paid caregiver, also family friend. And there were court proceedings for the other gentleman in the home who actually owned the home. And they wanted to make sure that we were present for the court proceedings as there were ongoing legal concerns that the paid caregiver would be evicted from the home on that day. There were also allegations that my gentleman, my client, was being left alone in the home and that there was no food for him. And I made contact. I had seen this all 3 of these gentlemen the prior year when the other case with the other gentleman was ongoing, and we had resolved that and gotten the professional guardianship in place and conservator. So I was familiar with these people. I went to the home, tried to make contact, couldn't get in the home. They asked that I meet them at a fast food joint. So we went to a burger place and where I observed my client. He was obviously with them out in the community. He was eating just fine. He could not understand the conversation going on because he is so hard of hearing and he did not have hearing aids at the time. Just on the surface, everything looked very good. He was well groomed, well provided for. He seemed very comfortable with his caregiver. There were no red flags. As time proceeded, we went to the court proceedings on the other gentleman, and sure enough, this gentleman was evicted from the home, which placed my client in an emergency situation where he needed emergency housing that day. I was able to place him with the help of all of our community emergency housing people. That evening, court lasted all day long. We did not finish court till 5:45 in the evening, so everyone had gone home for the day. but the emergency housing people were excellent in responding and helping this gentleman get placed for the evening. Otherwise, we were stuck at the courthouse waiting to know, where do we go, what do we do? So we got him in emergency housing. He was there for the weekend, and we found out it was not an appropriate place for him. He, being an elderly man and not speaking English very well, he was in this emergency housing was younger gentlemen that were more, had just a different level in life, young 20, 30-year-olds that needed assistance with this gentleman. We were also led to believe by the caregiver that my client could do his own ADLs, meaning he could bathe himself, groom himself, toilet himself, and that was not the case. So after he'd been there for a weekend, we knew that we had to get him into a more stable, appropriate housing. Now that he was separated from his caregiver, more things were coming to light. We found out after the eviction, and we could get into the home, that his medications were not being given to him properly. He had medications from 2017 that had never been refilled. We found out that he was, the caregiver was sharing the medications between the two gentlemen. We found out that he had not gone to his dental appointments, and his dentures had been sitting at the dental office for almost a year, waiting to be picked up. We found out that the bedroom doors had fingerprint access only by the caregiver, meaning my gentleman would be locked in his room when the caregiver and the other gentleman went out into the community. So it was very unsafe. We also found that there was exploitation going on. This caregiver was a power of attorney for my client. He had the client sell his home, and it was in a different part of the country. And within 3 months, $70,000 was gone, all into the caregiver's account and to the caregiver's bills. So my client did not benefit at anything of any of the funds from his housing. This put him at a great risk and required him to go on to Medicaid. We were able to work with some amazing community partners. Again, this was an emergency situation. We got him in the PACE program, which is a wraparound program. We have Medicaid, and then we have PACE. And if you're on Medicaid, you bill individual services. If you are on PACE, you pay PACE bills Medicaid for one thing, for everything. And it's a big deal. They only take clients on the first day of the month because you have to switch billing systems. I had 2 weeks, which is unheard of in the government, to switch a client from a Medicaid program to a PACE program with the assistance of our adult financial people at DHS, our PACE program people, our pro bono guardian, because there was no money, so we had to get a pro bono guardian, Rocky Mountain Options, and the physician's office. We were able to get this gentleman moved into the PACE program in under 2 weeks. He is now in a memory care facility. He is doing excellent. He now has his new dentures. He now has new hearing aids, and we have found that he can speak perfect English as long as he can hear, or if you write it down. If you write in English, he can speak to you all day long. He is doing amazingly well. He loves his pro bono guardian. We searched for family members, and another very sad thing that we found out when we found family members, they had been told that he had passed away in 2015 by the caregiver. They had no idea that he was still alive. They are all in another part of the country and did not feel that they, due to their own age, they could not take care of his needs. And they have spoken with the pro bono and guardian, and they are very comfortable with staying in touch with her and continuing to support him and talking with him from afar. And that's it.
Thank you. Please state your name, sign in, and you may begin.
Good morning, Mr. Chair. Good morning, Mr. Vice Chair Gonzalez and Commissioner Bremer and Commissioner Williams. If I may, is the overhead functional right now?
Just put your, whatever you have on there, and they'll bring it up. And he'll zoom out for you.
Fantastic. Okay, so I am here as a representative of the Pikes Peak Elder Abuse Coalition. I also do work for Silver Key as a director of their senior assistance programs. And briefly, I wanted to just state the mission of the Pikes Peak Elder Abuse Coalition. It was founded in 2005, so it's been around for 14 years. And I must say, given the community's efforts and collaborations going on, that we've really picked up momentum in some different areas. And I'll touch a little bit on those different subcommittees that are going on. So the vision of the Pikes Peak Elder Abuse Coalition is to have a safe environment for every at-risk adult. The mission, to facilitate community collaboration of services for the elderly, defined as 60 and over, and at-risk adults in the Pikes Peak region. The PPEAC will focus on the health and welfare of elder and at-risk adults, in addition to education and awareness of mistreatment in the Pikes Peak region. Currently, we have 10 different agencies and all participating on the Elder Abuse Coalition. 21 different professionals and agencies are meeting on a monthly basis, really coming up with solutions and talking about challenges we are having and seeing in the community amongst our older population. The subcommittees, the standing subcommittees that exist right now that are headed by really passionate individuals and really driven, because we are seeing tangible outcomes out of each subcommittee, and we're really dedicated toward moving toward our mission and our vision. So the first subcommittee is the Education and Outreach, and that's chaired by Detective Chuck Chakosky. Our next is the Emergency Shelter Program, chaired by Ms. Chrissy Swanson. And next we have our Guardianship Volunteer Advocacy Program, which is our newest subcommittee. And those chairs has been really a shared effort, but I will give recognition to Ann McKenzie and Susan Pavlika, who really catalyzed and we're a integral part in establishing, and we at Silver Key have actually had the privilege to implement that volunteer program internally with the intention of increasing the capacity of our professional guardianship program. So we recognize there being a need in the community for individuals who need decision makers, and so we want to be able to serve them in a way where no one is community-wide compromising the quality of care that those individuals who need decision makers receive. And next is our World Elder Abuse Awareness Day subcommittee, and they focus on coordinating the upcoming event that we see here in the flyer, and I'll let Amanda talk a little bit more into that. And so with that being said, I will pass it to Detective Chuck, who has been there since day one, and he could give a little bit more breadth into the history of the Elder Abuse Coalition. Thank you so much.
Thank you. All right, and I'll remind you as well, if you could, please state your name, sign in, and you may begin.
I'm Detective Chuck Chakosky with the Colorado Springs Police Department Crimes Against At-Risk Adults Unit. Like Dayton said, I'm one of the original members of the Pikes Peak Elder Abuse Coalition, and I chair the Education and Outreach Committee. Our committee's mission is to educate community professionals as to their duty as mandated reporters so that they can better understand and recognize abuse and report it early so we can get it investigated. And we also spend a lot of time teaching, and I'm going to call them older citizens, since I'm 67, I don't like to think of myself as a senior yet, personal safety. And so last year alone, we trained 685 community members in combination, and that's a team effort between members of the Department of Human Services and the Police Department. And the Sheriff's Office, too. We have a deputy who now is a community liaison who's working with the Sheriff's Office on us. Eric talked about the collaboration that goes on in this community, and I just want to let you know how great that collaboration is, and that actually the State Department of Human Services has reached out to us to try to get us to take our model for our cooperation between all the community members, but especially between law enforcement and APS, because that relationship does not exist in any other organizations in the counties in the state. And they want us to take this model out. Denver has copied our model recently. Aurora has copied our model recently. So we are setting the trend in this, not only in the state, but also we've received some national recognition. We are doing 2 presentations at the National Adult Protective Services Association Conference in Denver coming up in August.
Good morning, Commissioners. Thank you for allowing us to be here and share with you what is happening with our seniors in our community. I'm Chrissy Swanson. I'm chair of the Elder Shelter Committee. That subcommittee started in 2016 and originally was formed as a safe haven for residents that may have been found to be at risk for exploitation, mistreatment, neglect, self-neglect, and identified in the first year approximately 12 individuals. As we formed a coalition and became more aware of the clients in our community, that we now have served since 2016 over 130 at-risk adults that needed placement for safe haven. At that time, we formed a committee to set up some fluctuates between 8 and 12 different participating communities. I actually am the administrator at Colonial Columns. Our facility has been very passionate about it and has embraced the fact that we are caring for clients who have been abused specifically. And so I just wanted to give you some facts on that. In 2018, the Pikes Peak Shelter Committee served 71 clients. We actually had just joined in March the National Elder Shelter Alliance, called the Springs Alliance, and we had a data sheet that we had to put together. We were very surprised to find out that as a nation in 2018, only 111 people had been served through an elder shelter program, 71 of them here in El Paso County. So what we're doing is a unique model of collaboration between APS, the professional guardians, the pro bono guardians, the participating communities, DHS, the magistrate's office. It's unique and special, and that is why we are going to be going to the National APS Conference in Denver to share that with the other states. But what we're doing in El Paso County is phenomenal, and it has helped so many citizens.
My name is Amanda Banfield with Adult Protection Services. I am also the co-chair of the PPAC. I want to give a little bit more background on that GVAT program, the Guardianship Volunteer Advocacy Program. We actually had 17 members go through that program this year in order to help our professional guardians so they can take on more pro bono cases. Since we do not have a lot of paid cases here in El Paso County, by the time APS is involved, there's not a lot of money left. So we're very thankful to have those community partners to be able to do that. They've been split between a couple professional agencies and Silver Key. They're working out really well, which we're very thankful for, because hopefully they can take on more cases for us. I'd also like to talk to you about our World Elder Abuse Day. This is the second time that I've been on the committee. It's the first year that I've been co-chair of the committee, and I'm hoping that we have a really wonderful event and that it goes really well. And I thank you all for taking your time to listen to us today. Thank you.
Thank you. Is there anybody else that would like to speak on behalf of this proclamation?
I just want to say how proud I am of APS. I took it over in 2001 when it was a struggling program, and to see it grow and flourish like this is very heartwarming for me and very gratifying in my career. So I'd like to thank all these hardworking staff here that made it possible. So thank you.
All right, well, I'll bring it up here for some discussion. Anybody like to kick us off here? Commissioner Gonzalez?
I just wanted to thank everybody that's really participated in this, the staff particularly, for all the hard work about how and can help those in need. Because again, we sometimes remember to help You know, we talk the most needy children, but we forget about sometimes those in need are our elderly. So I appreciate that, and thank you again for everything.
Thank you. I'd also like to say thank you. You know, as an old deputy district attorney, I had the opportunity to prosecute cases involving at-risk adults, and it's, you know, it's absolutely heartbreaking to see the way that sometimes our, you know, the people that we should be honoring the most in our society are treated the worst by the folks that are taking care of them. So I can't tell you how important I think it is that we continue to highlight this issue, and that we continue to have a robust program that makes sure we're doing all we can to protect these neediest of our citizens. So again, thank you for all you do. Commissioner Williams.
Well, unfortunately, this is one of my favorite topics to speak on, and I speak to many people about it, friends. I try to direct my comments more to individuals who are age 40 to 60 who have parents or themselves, because one of the first things that there's science that proves the first thing that goes is your ability to do financial logic in your mind. So my story started in 2007 after Christmas. My mom and I don't know how far back the abuse goes. I suspect as early as 2000. My mother had borrowed $50,000 from my sister and sent it off to someone in Jamaica. And this kind of abuse, I call it the silent war on our senior citizens, because this is how the Jamaican gangs survive. I've been told by the FBI that you can walk into any of the Jamaican gangs' offices. They'll have your mother's name, Norma. They'll have all the kids. They'll have, mom wants to make sure all of her kids are billionaires by the time she dies. They'll have everything that's one of her trigger points labeled there. They'll have all of my kids listed under my name. And that's all they do is call and prey on seniors all day. And I've never been able to get my sister to tell me how much. The one thing we did do was get a conservator, and since she had learned she had lost the most, we made her the conservator, and I would never make a family member a conservator again because they still couldn't get a handle on it. And I figured to this day it's at least $1 million that she gave away. And all of the savings that my dad now, who is 90, that they'd had for a senior facility, they're all gone. So there are things that you need to be aware of. Also, too, as your parents are aging, it really helps to talk about moving into a main level facility. My dad's 90, he can only make it up 7 stairs. And then he has to have someone help him up the remaining 7. Seniors we are all very prideful, and he's stubborn. And so even just getting church members to come over and help him up those last 7, you know, he just won't do it. So while there's plenty of people willing to assist, and so there's a lot of things that we need to be aware of. So I really appreciate you bringing this forward and having this day so that people can understand. And it's something I think that the younger generation needs to understand. I told a friend my story, and she says, "Oh, I'm really good at accounting. I'll never give up my finances." I had another friend who said that when she went in to take care of her parents, the checkbook was filled with $25 checks to the National Republican Committee and the National Democrat Committee, because a lot of seniors feel that they have to pay their dues to the national parties to keep the IRS from coming and knocking on their door. And any single nonprofit every nonprofit in the world had hit her parents up for $25, and there was just page after page of $25 donations. So it's something that you need to sit down and talk to your parents about and tell them my story. And say it happens, and it will happen to you, and we need to talk about 1, when to take away the keys, and 2, when you're going to let me keep track of your finances. those are the two things the seniors, especially the car keys, are the hardest to take away from them. So I really appreciate all of your service in serving the elders in our community and in being aware of the not only the financial, as we say, sometimes by the time you get there for the physical and medical problems, the financial has already been stolen away. So I appreciate all that you do to help the seniors in our community. Thank you.
Thank you, Commissioner Bremer.
Thank you, Mr. Chairman. Thank you all. You know, the story that you shared with us today, it really highlighted the broad expertise required. You needed to pay attention to legal implications, financial implications, clinical knowledge, some program and policy, and also be aware of the community agencies and organizations that you could have come alongside you. And that breadth of understanding how to wrap services around someone who needs them is just, it's commendable. It's overwhelming to me. And I know that every single one of you, no matter which piece of that you have responsibility for, has done that, and you've done it ultimately for El Paso County citizens who needed you. So I am very grateful that you are there when we need it. I guess today is the day of personal sharing, but I'm also, long story, but I'm also a CNA. And one of the first things, I kept going back to the clinical book study side with several of your points. And that is, you know, it's our job, whether we're a caregiver or a family member, it's our job to preserve dignity, to make sure that no one feels restrained. You know, you can go into the technical details of that, but to preserve dignity. And sometimes it does mean having the tough discussions about when to take away keys or whatnot, but the focus has to be on preserving, allowing the greatest generation at this point to have their freedoms, have their dignities, and stay safe, and contributing members of society to the degree that they want to be. So I am honored to have moved this today, and thank you very much for all of your work.
All right. So it's been moved and seconded. And so with that, I will call the roll. Commissioner Bremer?
Aye.
Commissioner Williams?
Aye.
Commissioner Gonzalez?
Aye.
And the chair votes aye. That passes unanimously with Commissioner Vanderwerf excused. We will stand in a brief recess for a picture.